So there are, oh geez, that scared me. There are about 90 different sleep disorders. So we are going to be talking about sleep loss, and this refers to sleep of shorter duration than the 7 to 8 hours of sleep, the recommended sleep per night. It is a highly prevalent problem, and it continues to worsen in frequency as we get older, unfortunately. It's also a very prevalent problem for adolescents. Teenagers actually require about 9 hours of sleep. But most report not getting that because of academic demands, maybe working and doing school, socialization, and definitely increased screen time is a big one. So why is sleep so important? Sleep is critical for lots of reasons. It is important for our physical health, which we'll talk a little bit more about. And it's also really important for our physical restoration. It's important for our mental health, which again, we'll discuss further. Sleep improves our emotional regulation and our resilience to stress. It promotes improved productivity and overall brain function, and sleep supports cognitive functions like memory and learning. And better sleep simply can just mean an increase in our overall quality of life, which is something we all want. Physical effects of sleep deficiency. So there's a long list of negative physical effects of sleep loss and sleep deficiency. This includes, but is not limited to, an increased risk of chronic conditions like heart disease, hypertension, diabetes, obesity, increased risks of heart attacks and strokes. It can also cause hormonal imbalances, specifically hormones that control our hunger, and stress hormones. It can cause decreased energy and poor concentration, and decreased physical repair and restoration. So during sleep, this is the time that our body needs to repair cells and tissues, and this is when it processes toxins. And also growth hormones are released during sleep to help muscle and bone regeneration. So our body is really counting on that time. Mental effects of sleep loss. So again, a long list. This list includes, but is not limited to, increased risk of depression, anxiety, errors in judgment, poor memory, difficulty concentrating and making decisions, anxiety symptoms, increased alcohol use, and excess mental distress, including increased emotional reactivity, mood swings, greater irritability. It also compromises our memory consolidation, making learning and recall significantly harder. So signs of sleep loss and poor sleep hygiene. So this can include having a hard time falling asleep. You might be laying awake for hours on end before you actually fall asleep. Frequent night wakings with difficulty going back to sleep. So this is when we're waking up at 2, 3, 4 in the morning and we just cannot fall back asleep, which is a very typical sympathetic nervous system response when we're kind of stuck in our fight or flight. Daytime sleepiness, and just an overall lack of consistency in sleep quality and quantity. So why do so many of us struggle with sleep? Because it's a very common problem. So our stress levels, definitely a correlation between our stress levels and our sleep. Overall, people's stress levels have been steadily increasing. We have very fast-paced lives, lots going on. We have families to look after. We have demanding jobs. We have long lists of daily tasks. The list goes on and on. So stress or distressing events can cause short-term insomnia, and cortisol, which is our stress hormone, can keep you alert at night, preventing restful sleep. Struggles with mental health can cause us to struggle with sleep, depression, and anxiety. It can be the result of other illnesses, acute or chronic pain. Medications might interfere with our sleep. Increased alcohol consumption can very negatively impact our sleep, and there's going to be a slide where we're going to talk about that more. And then just life circumstances, significant life stressors, like all of a sudden having to take care of a loved one, issues with childcare, or like when we were in COVID and all of a sudden we had to become teachers, parents, work full time, and we were all stuck in lockdown, stuff like that. Or simply just scheduling too much in each day, which is something that we're all guilty of. We create these very busy, irregular routines that just do not prioritize rest.
Kelsey, can I just pause for a second?
Yeah.
Oh, never mind. Okay. We were having difficulties seeing the screens, but we're good now.
Oh, okay.
No worries. We're all good.
Okay. So let's talk about alcohol a little bit because this one does have very negative impacts. It does help you fall asleep initially because it does have sedative effects, but as the body processes alcohol during the night, sleep cycles are disrupted. So alcohol suppresses our REM cycle, so that rapid eye movement sleep, which is the stage of sleep that's really important for memory consolidation, emotional processing, and cognitive functioning. So this leads to less restorative sleep. Even if the total duration of sleep seems sufficient, we're just really lacking that quality of sleep. And then after even the alcohol is metabolized in our bodies, we then will experience fragmented sleep. So we'll wake up multiple times during the night. And this is due to alcohol's interference with the body's natural sleep cycle. So low amounts of alcohol, even low amounts, like this is less than 2 drinks for men, less than 1 drink for women, can decrease our sleep quality by 9.3%. And then moderate amounts, which is only 2 drinks for men and 1 drink for women, it decreases our sleep quality by 24%. And then large amounts, which is only defined as more than 2 drinks for men, more than 1 drink for a woman, decreases our sleep quality by 39.2%, which is huge. So experts do recommend no alcohol at least 3 hours before bed, if at all. And it also depends on how quickly your body metabolizes alcohol, but at least 3 hours is the recommendation. And also to note here, and I didn't put it on a slide, but caffeine, I think that's another obvious one, but caffeine does impair our sleep by delaying our sleep onset, reducing sleep duration, decreasing the quality of sleep, particularly that REM sleep and deep sleep. And the stimulating effects of caffeine can interfere with the body's ability to unwind and rest effectively. And screen time. This is another big one. So, blue light is a wavelength of light that is emitted by our electronic devices and artificial light. So, this includes our TVs, our smartphones, our tablets, and television. Or I said that one already, TVs. So, exposure to blue light in the hours leading up to bedtime can hinder our sleep. Blue light suppresses the body's release of melatonin, which is the hormone that makes us feel sleepy. And being exposed to blue light at night can actually trick our brains into thinking that it's still daytime. So this affects our circadian rhythm, which is our body's natural 24-hour clock. So this is what keeps your body operating on this healthy wake sleep cycle. And also social media or late night work can increase our anxiety, making it harder to wind down because then we often ruminate. We're comparing ourselves to others. We're comparing our lives to others people's. We really can go down some dark holes. So best to stay away from that before bedtime. So what exactly is sleep hygiene? Sleep hygiene refers to our behavior during sleep, as well as our sleep environment. Sleep hygiene is essentially forming positive daily habits around sleep that include a good bedtime routine and ensuring an optimal sleep environment, all of which to help promote consistent, restful sleep. Sleep hygiene improves our sleep quality, can regulate our circadian rhythm, and reduces our sleep disruptions. And we'll talk about some really good examples in the next couple of slides. And it should be noted, though, what might work well for one person might not work for the next. We need to discover what works best for us, what's going to be most realistic for us, deciding what habits we want to develop. And this is also true when we consider other factors like forced interrupted sleep schedules. So people that work shift work or people that have young children or babies, and because this can look quite different. It should also be noted that sleep hygiene alone will not cure sleep problems, such as diagnosed sleep disorders. So you should speak with your family doctor if you do have concerns about a sleep disorder. So let's talk about some examples of good sleep hygiene. So sleep environment. Keep your bedroom cool, dark, and quiet. Use white noise machines or fans. I find that very helpful. Invest in a comfortable mattress and pillows. Minimize distractions. So we want to keep electronics out of the bedroom if we can. I know we often rely on our cell phones for alarms and stuff like that, but we can go back to the old alarm clocks maybe. We want to really mitigate the effects of that blue light. So make it a routine to turn off your blue light devices at least 1 hour before bed. The longer, the better. And also make sure that your lamps that you have in your room do not emit the blue light. We want that red or orange instead. We can use night modes on your devices or dim the screens if you do need to have your device in the room with you. A lot of devices do have apps that dim the blue light, and a lot of glasses have lenses that block blue light too, which can be helpful throughout the day. So sleep schedule. So maintaining a consistent bedtime and wake up time, and this is true for on the weekends too, which I know is kind of a drag. Avoiding naps during the day also helps, or at least limiting naps to 20 minutes to prevent interference with our nighttime sleep. Pre-sleep routine. So engaging in relaxing activities 30 to 60 minutes before bed, like reading, stretching, listening to calming music, practicing mindfulness. We're not just scrolling on social media or watching TV. We want to get away from those screens. And I know this can be a really hard habit to break because we often just veg out on our couches and want to distract ourselves with our phones and TV. We also want to avoid heavy meals, avoid caffeine, and avoid alcohol in the hours leading up to sleep. Regular physical activity can also help with sleep, but we do want to avoid any vigorous exercise close to bedtime. So how to implement a good bedtime routine. So we want to introduce gradual adjustments. We want to start with small changes, such as adjusting your bedtime by 15 minutes earlier each night. Start by choosing maybe 1 or 2 sleep strategies to focus on, and then we gradually build on them. So again, we want to avoid stimulating activities. So cut off screen time at least 1 hour before bed. Try reading a book or practicing relaxation techniques or some light stretching. We also want to set boundaries, and this is a really important one. We want to limit our work. We want to limit our social media or even intense discussions in the evening to avoid that mental stimulation that might induce some anxiety or stress. And also tracking your sleep can be really helpful. So keeping a sleep diary or using a sleep tracking app to monitor your sleep patterns, and then we can identify areas for improvement. Tracking your progress can be really helpful, but we also want you to be patient because it may take time to see some improvements. So shift work and sleep. So I do want to touch on a couple of those forced interrupted sleep schedules, like I mentioned before, and shift work is a prime example of that. So irregular sleep patterns disrupt the body's circadian rhythm, so that natural 24-hour clock, that wake-sleep cycle, leading to fatigue and cognitive impairment. And shift work can also cause an increased risk of physical health problems. Shift work can actually cause a circadian rhythm sleep disorder, which is characterized by insomnia, excessive sleepiness, resulting from work hours that occur during the normal sleep period, including night shifts or early morning shifts, rotating shifts. Total sleep time is normally reduced by 1 to 4 hours, and sleep quality is disturbed. Individuals can experience excessive sleepiness, reduced alertness, and reduced performance capacity. And it can also have some negative social consequences as well. So it's hard with shift work, but strategies that you can try include consistent sleep schedule. So even with the shift work, trying to maintain as consistent a sleep schedule as possible. Creating a dark sleep environment. This is very important, using blackout curtains to block out daylight when trying to sleep during the day. Use white noise to block out any noise from your surrounding environment. Strategic naps, if you're able. Short naps, even 20 to 30 minutes, can help boost alertness during shifts, especially for night shifts. And also journaling before bed when you're coming off a night shift can be super helpful to kind of get out all those thoughts onto paper, and then you're better able to just go to sleep. And sleep for parents with littles. And I know some of these strategies may not be realistic depending on your situation. And I know this is easier said than done, so please don't want to throttle me when I say these things. I get it. So this is for parents who have young children, who have babies. They're waking up frequently through the night due to infant care, feeding schedules, so many things, right? parents can also experience anxiety when we're laying there in bed at night. We're worried about our kids. We're worried about their development. We're worried about their safety and all these other parenting concerns, and that can disrupt our sleep. So some strategies, and again, I realize may not be realistic for everybody, but napping when possible, doing sleep shifts. So if possible, alternating nighttime care with a partner or with a family member, and just really creating a restful environment. So making your bedroom as restful and calming for yourself as it can be. Dim your lights, use white noise machines or use fans, soothing music, really establishing a calming sleep environment. So I do want to talk a little bit about cognitive behavioral therapy for insomnia, or CBTI. So beyond the strategies that we just discussed in the last few slides, they may seem very simple, but small changes do add up to make really big differences. And so here are some more techniques that I'd like to briefly introduce. And these are techniques and strategies that can be further explored in therapy. So CBTI is a structured program that does address the thoughts, behaviors, and emotions contributing to poor sleep. So cognitive restructuring, this includes identifying and challenging any negative or unrealistic thoughts about sleep and maybe reframing beliefs that lead to anxiety around sleep. And behavioral interventions, so these are strategies that aim to change our sleep-related behaviors, which often perpetuate insomnia. And also providing some psychoeducation, so helping clients understand normal sleep patterns and debunking any myths that they might have around sleep. So let's discuss some specific examples. So the first one is stimulus control. So this intervention involves retraining people to use their bed only for sleep or for sex. So we really want to associate the bed with sleep only to strengthen the mental association between the bed and sleep. So this includes going to bed only when you're sleepy, getting out of bed if you can't fall asleep within 15 to 20 minutes, and then returning to bed only when you're sleepy, and then kind of repeating this pattern throughout the night. So if you can't fall asleep in 15 to 20 minutes, you're going to get up. And then we're going to try again. If that happens again, we're going to get up again. And you're going to repeat this pattern. This also includes getting up at the same time every day, again, including on the weekends, and avoiding napping during the day. Sleep restriction therapy is also another CBTI technique. So again, we're limiting the time in bed to match your actual sleep time, which can improve your sleep drive. So in bed to your average nightly sleep time, just nothing less than 5.5 hours. And then you're gradually increasing your time in bed. So again, we're kind of trying to create that bed-sleep association. Relaxation techniques that can be very helpful. So methods like deep breathing or mindful breathing, progressive muscle relaxation, meditation, guided imagery, all with the intent of reducing tension and stress and anxiety that could interfere with sleep. And again, sleep diaries, so tracking our sleep patterns so we can identify areas that we might need some improvement in, and thought logs to track negative thoughts about sleep. And again, establishing that really good wind down pre-sleep routine. And here is an example, or the example of a great behavioral intervention is that mindful breathing. So practices like 4-7-8 breathing. So we're inhaling for 4, we're holding for 7, and exhaling for 8, and repeating that. And this is the intent to calm the nervous system and prepare for sleep. Or paced breathing, and this is 3 counts inhalation and then 7 out, and you're repeating that for 20 minutes. The goal is to get about 6 breaths per minute, and studies showed that increased sleep quality and efficiency. Breathing is definitely one of the most effective and gentlest ways for us to complete our stress cycles and to stimulate our vagus nerve, which in turn turns on our parasympathetic nervous system response, that rest and recover, and signals to our nervous system that it's time for us to be able to rest and relax. So all of those, the CBTI, all of those strategies are stuff that can be discussed in therapy and incorporated with the help of a therapist. So addressing our basic needs for emotional regulation and distress tolerance. So our basic needs refer to things like eating. Are we eating enough? Are we properly fueling our bodies? Are we getting some form of physical activity in? Are we getting enough sleep? Addressing our basic needs can become a starting point for therapy because we want to ensure that we have a solid starting point for emotional regulation and for distress tolerance. And when I say emotional regulation, this refers to the ability to manage and respond to emotional experiences in a very healthy and adaptive way. And lack of sleep can significantly impair that. And similarly, our distress tolerance or our stress resilience is the ability to endure and manage emotional pain or discomfort without resorting to those unhealthy coping strategies. And lack of sleep can significantly impair our ability to handle stress and regulate our emotions. It can cause increased emotional reactivity and impulsivity. We might become more sensitive, impaired emotional processing. So during sleep, particularly that REM sleep, the brain processes and consolidates our emotional experiences. And this is essential for us to be able to manage stress and anxiety, as it allows us to make sense of our emotional experiences and develop healthier perspectives. And reduction of resiliency to stress. When we're sleep deprived, our ability to cope with stress just diminishes. More likely to feel overwhelmed by stressors and struggle to tolerate any sort of distress. And the body's natural stress response system, so including the release of cortisol, becomes dysregulated with poor sleep. So it makes it, again, harder to manage our stressful situations calmly. So when we are well rested, individuals are typically better able to respond to challenges with more perspective and balance and utilize adaptive coping strategies like some of the ones we discussed, like problem solving, like self-soothing, seeking support, incorporating mindfulness, incorporating breathing techniques, cognitive reframing, so many things. Sleep does provide a reset for our nervous system, allowing us to approach challenges with a clearer mind and a more balanced emotional state. And this is an analogy I use quite a bit with my clients, and it's the stress bucket. We all have stress buckets. They fill up with big stressors, little stressors. They fill up every day. And sometimes we get to the point where we feel like our stress bucket is overflowing or it's about to overflow. So we need to find ways to kind of open up that little tap there to let some of that stress out. And sleep is one of the ways that we can do that. It might seem small and trivial and simple, but as I said before, these small changes are what make big differences. So if we can focus on these small things, like trying to adjust our sleep a little bit, like eating properly, like getting some physical activity in, plus coping strategies, then we're providing opportunities for us to be able to drain off a little bit of some of that stress, and every little bit helps. So here are just some additional resources where I got some of my information if you guys are interested in that. And that brings us to the end of the presentation. So we would love for you to book a consult. We do offer virtual or phone consults. So if any of this information resonated with you or you want to discuss any of this stuff further, then please book a consult. You can go onto our website, read all the bios of everybody that's here, and find a potential best fit for you. Also, make sure you join our monthly wellness webinar series. They will happen every month. On the next slide, I will show you the information for next month's presentation. We also have ongoing workshops. We do have a couple coming up in February, Managing Motherhood with Sarah Rice, and I have one next week with the other Sarah, Supporting Supporters Workshop, so a workshop for families and loved ones of first responders. So let me show you the information for next week. So next month, Friday, February 21st, again at 12 o'clock. The topic is strengthening communication in relationships. And this is going to be presented by Leah, who is another student here, and she's a Master of Social Work candidate, again, working under Kyla. So that is the end of the presentation. Does anybody have any questions, comments?
I do want to comment. Thank you, Kelsey. But one of the biggest things I heard is stimulating activities before bed. And I
Mhm.
feel like that is, like, end up being a mom myself, or even as a business owner, like that is something that like bedtime is the time that I have to do those things. And so I
Right.
think that's my biggest takeaway from what you presented, is really trying to carve um, different times for that, right? So it's common that I'll get the kids to bed and then say, actually, I'm just going to spend 10 minutes just checking my emails or responding to those emails. But then 10 minutes turns into like 2 hours, or then I lay in bed and I can't get to sleep. So then I get up and do more. And
Mhm.
so I can totally see how, like, even just stimulation to your brain at that time, right, can be really hard to settle in. And I wonder even about like writing to-do list. That's sometimes I often recommend for clients to write a to-do list before bed if they find their
Mhm.
head is spinning and all the things they have to do. It's like, okay, write a to-do list, get it out of your head, and then go to sleep. But that actually might be just stimulating for somebody as well.
It could be because then it's kind of making it very apparent what all you have to get done. But it might be more soothing for somebody else. And that's kind of a trial and error, right? But again, it's kind of like getting those thoughts out on paper that can be very helpful. Like again, with journaling, I had to do that quite often after night shifts because I had to get, these thoughts that are circulating in your head out. So it could be helpful for someone to feel like that's enough to kind of release that from their brain. But yeah, for somebody else, it might cause more stimulation or more worry or more anxiety. So that's kind of a trial and error thing. But like you said, like, and I know that, yeah, you get work done after your kids go to bed, and I totally get that and appreciate that. But that is kind of going back to setting those like self boundaries too and keeping them firm, because it gets so easy to be like, oh, I'm just going to check this for 5 minutes. But then that turns into 10 and 15 and then turns into 2 hours. And so setting those firm self boundaries and trying to stick to it. But again, it's breaking those habits that we've developed, right? So it
Yeah.
can be hard. It
Another thing
takes
I think
time.
is connecting with your partners too. So I know sometimes by the time both partners get done their things for the day, get the house cleaned up, whatever it be, then they sit down and that's their time to connect about all the things happening that week, and
Right.
how stimulating that can be for the brain as well. So
Yeah.
I really appreciate you bringing that up, because I think we don't realize how stimulating our stimulation how much stimulation our brain is under in the evenings, because that's kind of sometimes when we just are wrapping everything up, versus
Yeah.
actually having these conversations in the morning or like throughout the day, carving that time out. Because I also hear a lot with couples who come in that say, I'm coming to talk to my partner at bedtime and they're sleeping, or they
Mhm.
are so tired that they're not engaging and they are dozing off in the middle of the conversation, and that be like a very challenging thing for communication. Um,
Mhm.
but maybe also like it's not the best time to do it. So that's really,
Mhm.
really cool. I really appreciated that little tidbit.
Thank you.
Mhm. So far, I haven't seen anything in the chat except for it was very informative and great job. So awesome, Kelsey. Thanks for
Yep.
bringing this material to us. If with CBTI too, like I am trained in CBTI, so there's lots of resources here at the clinic too. So definitely come and connect with us if you feel like you could benefit from having more one-on-one support through this. It doesn't have to be long-term therapy, but just even some brief support. One of our therapists can work with you to get you through those goals for sleep. I love that you brought that in there. Are there any
Perfect.
questions or anything that we need to ask Kelsey right now? A few minutes. So the goal is that this recording will be available on our website eventually. I have yet to get to that, but it will. That's the aim of all of these that we've been compiling, which is why we recorded them. So if you have any questions about the content in the meantime, or you want to take a peek at the slides, just send us a quick email and we can find a way to get that to you. Okay. Otherwise, I will end the Zoom and recording.
Okay. Thank you, everybody.